What if I told you that the single most dangerous moment of your entire day happens before you even take your very first step? It is not when you are navigating a slippery shower floor. It is not when you are walking down a steep flight of stairs. And it is not even when you are crossing a busy, icy parking lot in the dead of winter. No, the real danger zone happens the exact second you swing your legs over the edge of your mattress and try to stand upright. Right now, at this very moment, millions of people over the age of 70 across the country are doing that exact same thing every single morning. They are going from lying completely flat to standing fully upright in a matter of just a few seconds, and their bodies are completely, utterly unprepared for it. Their blood pressure has not had a single moment to adjust to the massive shift in gravity. Their muscles are still incredibly stiff and cold from hours of immobility. Their internal balance system is still half asleep, trying to figure out which way is up. In that brief, highly vulnerable window of time between lying down and standing up, one single wrong move, one sudden bout of dizziness, or one misjudged step is all it takes to change your life forever. Over the course of my 26 years working directly with patients as a physical therapist, I have seen this exact scenario play out more times than I can possibly count. A person wakes up feeling absolutely fine. They sit up way too fast. They get a sudden wave of dizziness. They reach out blindly for a piece of furniture or a nightstand that isn't actually there, and that is the exact split second that changes everything. But here is the vital truth I want you to truly understand today. This terrifying scenario is entirely preventable. In fact, you can dramatically reduce your risk of a devastating morning fall before your feet ever touch the cold floor. You can do it without getting out of your bed, without buying any expensive exercise equipment, and in less than 5 minutes of your time. That is exactly what I am going to show you how to do today. And if you enjoy this video and find real value in what we are covering, please type a 1 in the comments down below. If it is not quite what you are looking for, type a 0 so I can truly understand how to make better, more helpful content for you in the future. I personally read every single comment that gets posted, and your feedback genuinely matters to me. To understand why this is so critical, we have to look at why mornings are universally the most dangerous time of day for your body. Let me break down exactly what is happening inside your physical systems when you first wake up, because once you truly comprehend the physiology behind this, you will never rush out of bed ever again. When you have been lying completely still in bed for 6, 7, or 8 hours straight, several physiological changes happen simultaneously. First of all, your muscles cool down and become incredibly stiff. Think of your body exactly like a car engine that has been sitting outside overnight in freezing weather. You wouldn't turn the key and immediately slam on the gas pedal to jump onto the highway. That engine needs time to idle and warm up before it is ready to perform safely. When you jump right out of bed without a proper warm-up, you are asking cold, rigid muscles to immediately take on the full burden of your body weight, manage your complex balance, and respond instantly to any unexpected trip or slip. That is an absolute recipe for trouble. Second, your blood pressure naturally drops while you sleep. When you are lying flat, your heart doesn't have to work very hard at all to circulate blood throughout your body because it doesn't have to fight against gravity. The moment you sit up, especially if you do it quickly, your heart suddenly has to scramble to pump blood upward against the forces of gravity to keep your brain oxygenated. For many people over the age of 70, this cardiovascular adjustment simply does not happen fast enough. The technical result is a condition known as orthostatic hypotension, which is a sudden, sharp drop in blood pressure that causes immediate dizziness, lightheadedness, blurred vision, and in some severe cases, a complete loss of consciousness. This is one of the absolute leading causes of morning falls, and the scariest part is that most people have absolutely no idea it is happening to them until they are already losing their balance. Third, your internal balance system is incredibly sluggish when you first open your eyes. Your brain relies on 3 separate complex systems to maintain your balance: your eyes, your inner ear fluid channels, and the specialized sensory receptors located throughout your muscles and joints. After hours of complete stillness and deep sleep, all 3 of these intricate systems need a bit of time to recalibrate and sync up with one another. When you stand up too quickly, you are asking your balance system to perform at its maximum capacity before it is even fully awake. Now, here is the critical point I want you to remember. All 3 of these major problems can be fully addressed and corrected before you ever leave the comfort of your bed. That is the entire purpose of the routine I am sharing with you today. By the time you finish these 5 simple exercises, your muscles will be warm and pliable, your circulation will be fully adjusted to gravity, and your internal balance system will be completely online. You will be able to stand up safer, steadier, and with far more confidence every single morning. Let us dive right into exercise number 1, which is ankle pumps and circles. Why this matters is incredibly simple, yet profoundly important. Your ankles and your calves serve as your body's secondary circulation pump. Every single time your calf muscles contract, they physically squeeze the deep veins in your lower legs and forcefully push pooled blood back up towards your heart and your brain. After hours of lying completely still, blood naturally pools in your lower extremities due to lack of movement. Ankle pumps get that vital circulation moving again, which helps your overall blood pressure adjust smoothly before you ever attempt to sit up. They also begin the process of warming up the ankle joints themselves, which are absolutely essential for maintaining balance and taking safe steps. To perform this exercise, start by lying completely flat on your back with your legs straight out in front of you. Flex both of your feet back towards your body, pulling your toes up toward the ceiling as far as you comfortably can. Hold that deep flexed position for 2 full seconds and then point your feet completely away from you, extending straight through your toes as far as comfortable. Hold that pointed position for another 2 seconds. That counts as 1 full repetition. Go ahead and perform 15 full repetitions of this pumping motion. Once you finish those 15 pumps, keep your legs completely still and slowly rotate both of your feet in large, deliberate circles. Perform 10 slow circles in a clockwise direction and then perform 10 slow circles in a counterclockwise direction. Make sure you move slowly and utilize your full absolute range of motion. As you do this, you should begin to feel a gentle, soothing warmth building up in your calves and your ankles. What you need to focus on during this movement is keeping your upper legs completely relaxed on the bed. The movement should be coming strictly from the ankle and the foot joints alone, and you must remember to breathe normally and deeply throughout the process. Moving on to exercise number 2, we have the knee to chest gentle pulls. Why this matters comes down to what happens to your spine and hips overnight. After a full night of sleep, your lower back, your hips, and your hip flexor muscles become deeply compressed and tight. These happen to be the exact muscles you desperately need to lift your legs, stabilize your pelvis, and maintain total control over your movement as you stand up. This gentle stretch safely releases that built-up tightness before you ask those muscles to do any heavy lifting, effectively reducing morning stiffness, improving localized blood flow to the entire hip region, and waking up those vital sensory receptors in your joints that feed structural information directly to your balance system. To do this properly, while you are still lying flat on your back, slowly bend your right knee and bring it up towards your chest. Reach both of your hands behind your right thigh, making sure you are holding the back of the thigh and not pulling on the knee joint itself, and gently pull your leg a bit closer to your body until you feel a comfortable, releasing stretch in your lower back, your hip, and your buttock. Hold this position for 20 to 30 seconds while breathing slowly and deeply. Release the stretch slowly, lower your right leg gently back down to the mattress, and repeat the exact same process on your left side. You want to complete 2 full repetitions on each side of your body. What you need to focus on here is safety and comfort. Never pull by the knee joint itself to avoid unnecessary stress on the joint capsule. Always clasp your hands securely behind the thigh. Keep your opposite leg as relaxed as possible on the bed. If you find that you cannot reach behind your thigh comfortably due to flexibility limitations, simply loop a towel or a sturdy belt behind your leg instead to extend your reach. This stretch should always feel relieving and therapeutic, never sharp or painful. Next up is exercise number 3, which is supine marching. Why this matters is because this specific exercise acts as a direct physical bridge between your bed and your active morning routine. Supine marching, which simply means performing a marching motion while lying flat on your back, actively wakes up your hip flexors, engages your deep core stability muscles, and begins training the exact structural movement patterns you use every single time you take a step forward in life. It continues the process of improving your systemic circulation and starts sending incredibly strong neurological signals from your legs straight to your brain, essentially booting up the complex communication system that your balance entirely depends upon. To perform this, lie flat on your back with your knees bent and your feet placed flat on the surface of the bed. Slowly lift your right foot just a few inches off the mattress, lifting only enough to feel the front of your hip flexor muscle actively engage. Hold that foot in the air for 2 seconds, then lower it back down slowly and deliberately. Next, lift your left foot in the exact same manner, holding it for 2 seconds before lowering it back down with total control. That counts as 1 full repetition. You want to complete 10 repetitions on each side, which equals 20 total leg lifts. Make sure you move at a very slow, highly deliberate pace. Think of this exercise as marching in slow motion. Each and every lift should be completely intentional and highly controlled. What you want to focus on here is keeping your lower back gently pressed down into the mattress beneath you. Do not allow your back to arch up toward the ceiling. Keep your core muscles lightly engaged throughout the entire movement. If lifting your foot completely off the mattress feels uncomfortable or too challenging, you can easily modify this by simply pressing one heel firmly down into the mattress while the other heel lifts up slightly. You will still get the wonderful muscle activation you need. As a quick progress tip, as this movement becomes easier for you over time, try holding each individual foot lift for 5 full seconds instead of 2. This simple adjustment significantly increases the challenge to your hip flexors and your core stability. Now we move to exercise number 4, which is the seated ankle taps. Why this matters is profound. This is your critical transition exercise, the specific movement that safely shifts your body from lying down flat to sitting upright. Sitting on the edge of your bed is a significant postural and cardiovascular change all on its own, and this exercise gives your body the necessary time to adapt to that new upright position while continuing to strengthen your ankles, activate your core, and train the dynamic balance you need for walking. Think of this exercise as your final systems check before you attempt to stand all the way up. To perform this, slowly bring yourself up to a comfortable seated position right on the edge of your bed. Make sure you take 10 full seconds just to complete this sitting up phase. Do not rush it under any circumstances. Plant both of your feet flat on the floor, keeping them about hip width apart. Sit up as straight and tall as you can, resting your hands gently on your thighs for support. Now, keeping your heels firmly planted on the floor, lift the toes of your right foot up toward the ceiling as high as comfortably possible, and then tap them right back down. Immediately after, lift the toes of your left foot up and tap them back down. That is 1 repetition. Complete 15 repetitions on each side, alternating back and forth between your feet. Once you finish those, you are going to reverse the motion. Keeping your toes firmly on the floor, lift your right heel up as high as you can, tap it down, and then lift your left heel up and tap it down. Complete 15 repetitions of these heel lifts on each side as well. What you need to focus on during this exercise is maintaining an upright, tall posture throughout the entire process. Do not slouch your spine or lean too far forward. Keep your breathing slow, steady, and regular. If you happen to feel even a slight wave of dizziness during the sitting phase, stop the tapping motions immediately and simply focus on taking slow, deep, calming breaths until the dizziness fully passes. If the dizziness does not completely pass within 30 seconds, gently lie back down on the bed and call for assistance. As a progress tip for when this becomes comfortable, try performing these ankle taps with your eyes completely closed. This forces your internal balance system to rely entirely on the sensory information coming up from your feet and ankles, which is exactly the kind of advanced neurological training your brain needs to handle real-world balance challenges. That brings us to exercise number 5, which is seated shoulder rolls and deep breathing. Why this matters is because this final exercise serves 2 incredibly powerful purposes that most people would never expect from a fall prevention routine. First, your shoulders, your neck, and your upper back are often deeply tense and tight after a long night of sleep, and that upper body tension directly negatively impacts your standing posture. Having poor posture when you stand up means your head is tilted too far forward, which shifts your entire center of gravity out of alignment and compromises your balance from your very first step. Second, practicing deep diaphragmatic breathing directly stimulates your vagus nerve, which is the main highway of your parasympathetic nervous system that helps actively regulate your blood pressure and heart rate. Taking 3 to 5 slow, deep breaths while sitting perfectly upright can meaningfully and measurably reduce the risk of that sudden blood pressure drop that causes dangerous morning dizziness. To do this, while still seated safely on the edge of your bed, roll your shoulders slowly backward, bringing them up toward your ears, pulling them back, dropping them down, and cycling them around in a large, completely relaxed circle. Perform 5 slow shoulder rolls in a backward direction, and then perform 5 slow rolls in a forward direction. Let your neck relax completely and let your jaw soften. Next, place one of your hands flat on your chest and place your other hand flat on your belly. Take a very slow, deep breath in through your nose for a count of 4, focusing on feeling your belly actively push outward against your hand, rather than allowing your chest to rise up. Hold that breath gently for a count of 2, and then exhale slowly and completely through your mouth for a count of 6, feeling your belly naturally fall back inward. Complete 5 of these slow, deep, diaphragmatic breaths. By the time you finish this final breathing exercise, your posture will be noticeably taller, your muscles will be warm and ready, and your cardiovascular system will be perfectly prepared for the physical transition to standing upright. What you need to focus on here is never rushing the breathing process. This is not just a relaxation technique, it is a vital physiological preparation for your body. Each and every breath is actively helping your internal systems regulate themselves. So let the process work. Now comes the absolute final step of the routine, which is the 30-second pause. This is not an exercise in the traditional sense, but it may very well be the single most important part of the entire morning routine. After you complete exercise number 5, right before you attempt to stand up, I want you to simply sit still on the edge of your bed for 30 full seconds. Keep your feet flat on the floor, your back perfectly straight, and breathe completely normally. This deliberate pause gives your blood pressure one final crucial window of time to fully adjust to the upright position. It allows the fluid in your inner ear to fully recalibrate. It lets your eyes completely adjust to the morning light, and it completely removes the single most dangerous element of any morning routine, which is rushing. When you do finally stand up after those 30 seconds, make sure you push down firmly through your heels, not your toes, and stand up completely tall immediately. Do not lean heavily forward as you rise. And if there is a nightstand, a sturdy bed rail, or a wall within arm's reach, make sure you have your hand resting near it or lightly on it for the first few seconds of standing. This is not because you expect to fall, but rather because providing that physical safety net gives your nervous system the immense confidence it needs to perform at its absolute best. To put this all together into one easy blueprint, here is your complete, comprehensive morning preparation routine from the exact moment you wake up. While you are still lying down flat in bed, you will start with exercise 1. Ankle pumps and circles, performing 15 pumps and 10 circles in each direction. Next, you will do exercise 2, knee to chest pulls, completing 2 holds on each side for 20 to 30 seconds each. Then you will move to exercise 3, supine marching, completing 10 controlled repetitions on each leg. After that, you will transition to being seated on the edge of your bed for exercise 4, seated ankle taps, performing 15 repetitions in each direction for each foot. Then you will finish with exercise 5, shoulder rolls and deep breathing, doing 5 rolls in each direction, followed by 5 deep belly breaths. Finally, you will perform your 30-second seated pause before standing up completely. The total time for this entire routine is just 4 to 5 minutes. That is truly all it takes. And those 4 to 5 minutes could quite literally be the exact difference between a perfectly safe morning and a devastating, life-altering fall. Consistency is the ultimate secret to making this work. I want to be completely honest with you. You will not feel a dramatic, magical difference after just one single morning of doing this. But after one full week of performing this routine consistently, you will absolutely begin to notice that you feel noticeably steadier the moment you stand up.